Okay, well, I don't know how to do it any other way than to name the doctors.
I would go ahead and name them, but remember, you don't have to say anything that you don't feel is the truth.
Say the truth, everything. What's your name?
Murray Paul Snow.
And could you describe the conditions that you have right now as far as your eyes and your heart?
Well, my eyes, the retina is deteriorating. The heart disease now,
Ischemia?
ischemia heart disease. I have emphysema.
Do you also have cataracts?
Yes.
And how about glaucoma?
No.
No. Okay, maybe what we should do is go into the time period between 1973 and to 1983 when you were being treated by Dr. Hughes. And what I was interested in is primarily what you had for symptoms that you were going through as far as your bowels, your respiratory.
Yes, I had colds a lot and virus.
Yeah.
Then I had problem to sleep.
Yeah. Did you also have constipation?
No, not that first.
Yeah. Did you have bronchitis a lot?
Yes.
How about your throat and your digestive tract? Did you have problems there?
No.
Let me see. These sleeping disorders, even though you were, can you remember what you were being prescribed for medications?
Dalmane 30
Yeah.
to sleep.
Yeah.
I was prescribed Elenville.
It was 25 mgs, I think.
Yes.
You had mentioned to me something about the way that he wrote out the prescriptions and differed than the way he wanted you to take these.
No.
Did he provide you with free samples of the medications?
Yeah, once in a while. They cut your hand from your mouth.
Did he give you large samples of free medications?
Well, sometimes was small sample.
Like hospital packs?
Yeah.
Those big strips, things like
Yeah.
that? Boxes of the medications?
No, can't remember boxes.
Yeah. When you were taking these, the cough medicine, I noticed he prescribed a lot of cough medicine. Did you always take that cough medicine, or did it bother you?
Yes, I took it as long as I had the cough.
It didn't bother you in any way?
I can't remember.
Yeah.
That's too long ago.
Yeah. Let me see. What about his comments towards myself or other patients that he had? What was? Did he like me or like his other patients?
I can't remember about those things. That's a long time ago.
Like his comment about the attorney, or something about an attorney he was making comments about?
Can't remember that.
About Ken? think you could describe that?
Well, he was just saying that he was an alcoholic and he did crazy things and that's about it.
Can you describe what types of crazy things you said to about Ken?
No, he said he'd do crazy things.
There wasn't anything that you can remember about children?
No.
Let me see, why don't we just move on to when you were hospitalized, okay?
Yeah.
Before being hospitalized, can you describe how you felt?
Well, I felt like my head was funny
Yeah.
and I couldn't concentrate.
Do you have problems walking?
No.
You had mentioned too about the ants in the cellar, or bugs or something.
Oh yes, there was lots of ants in the cellar
Okay.
because I went and sprayed them.
Yeah, okay. Well, we'll just move on. When you went into the hospital, can you remember anything as far as going into the hospital? What had happened at that point?
Yeah, they gave me a shot and I just went out and I was out for, I must have been out a week. I don't know, it might not have been a week.
Yeah, okay. Did you have anything weird right after the shot before you went out? Did you have any adverse effects, see anything, hear anything?
When was that?
After they gave you this injection, when you went into the hospital, did you see anything strange or weird? Do you remember any of that?
No.
No, just went out. When you came out of this thing, did they give you laxatives or anything like that? Or?
I can't remember.
Yeah. How about, could you remember which nurse gave you that injection?
No.
When you came out of this, did they give you an enema or anything when you came out of it?
No.
Can't
They
remember.
did the second time that I went in.
Okay. After you got out of the hospital, I noticed in your records that you were being given 75 milligrams of Yellowville. Before you had been taking, what was it? Do you remember what you were taking before?
75.
Can you describe what had happened when you came back, the feelings you went through at that time?
Well, I was scared.
Yeah.
I could hear people down cellar.
Yeah.
And I thought that they were breaking in.
Yeah. Anything else?
No.
Were the ants back again?
I didn't go down cellar.
Okay. You felt very depressed at that point, or?
I was scared.
Yeah. Were you confused or any other?
Yes.
Yeah. Do you remember your eating habits?
No.
In your records it says that you slashed your wrist, but do you have any recollection of that at all, or?
No, but I remember there was blood.
Yeah, okay. Did you all of a sudden become not confused when you went back into the hospital? After
No.
you were still confused?
Yes.
Yeah.
Then I was, then they gave me things and I was, I would hear all kinds of things.
Yeah.
And I would hear dogs, and I would hear Dr. Hughes, and he would hurt children, and he, but
Can you remember the medications that they were giving you?
no.
Can you remember them giving you the medications?
Oh yes, they gave me a lot of medication.
In the beginning of when you went the second time, remember being given any injections or?
No.
Let me see.
They would give me things to sleep, and I watched the light, and then I could see ants on the light,
Yeah.
and then I could hear the nurses and the doctor, and they were talking at the end of the hall, and they were laughing.
Yeah. Let me see if I can. As far as, yeah, you were given, I guess, Dr. Hughes, I remember him coming in and he wanted you to sign some sort of paper. Can you describe that?
No, it wasn't him that came in.
Yeah, no, what I'm talking about is when there was the argument, if he wanted to give you shocks of some sort.
No, that was a nurse that come in, and
Yeah.
she said it was some kind of paper I should sign.
Yeah.
But then you come in and she would go out with the paper.
Yeah. Was
But
that,
finally one time, I must have signed it.
yeah. Did they tell you what the paper was for?
I thought they said insurance.
Yeah. Was that Karen who was bringing in the paper?
I don't know.
Yeah. Okay. Can you remember an argument when Dr. Hughes dropped you as a patient?
Yes, because we asked for a second opinion for shock treatment, and he said he wasn't gonna have second opinion, and he didn't want to have anything to do with us.
Yeah.
And that's when his throat was bothering him.
Yeah.
And Dad asked him to look at his throat, and he said no, he wouldn't. And that's when Dad started cancer of his throat.
Yeah. Let me see. Can you remember?
They gave me 2 shock treatments.
Yeah. Can you remember both myself and Dad saying no electroshocks in a second opinion to him?
Yes. Hurry up, I'm tired.
Okay, well, at one point the nurses, you were telling me they didn't want you to have any water. I had gone in there quite a few times and you didn't have any water,
Yeah.
even after the electroshocks were done. Can you describe anything about that?
No.
All right, maybe we Did Dr. Fontana come see you?
Yes.
Yeah. What did he have to say?
And he said that I was alright, that I was fine. He checked my chest and he said I should be going home.
Yeah.
And then Dr. von Aldenburg came and he said what you need is good food and to put on weight, and you have to put on 5 pounds and then you can go home. And they brought me the best of food that there was.
Yeah.
I had roast beef, I had steak, I had scallop, I had fried chicken, I had all kinds of good food, and I put on weight. And it kept coming back every day.
For the year that you went and saw Dr. von Aldenburg, how did you feel?
I started to feel some better.
Could you concentrate?
Well, I could cook.
Yeah, but could you concentrate? Could you remember things?
Yes, and I could drive.
Yeah.
Then all of a sudden I couldn't drive anymore.
Yeah. Were your eyes blurry or anything?
No,
You have dryness? You have sleep problems?
no.
So, when we came to Maine, how did you feel about, you went and saw Dr. Fleischman?
Yes. And he was very good. He was the best one. And he's the one that helped me because he cut out all of those junky pills that von Aldenburg was giving me.
Yeah.
And I went down from, I was taking like 15 pills a day, and he cut me down like 4 or 5 a day,
Yeah.
different pills.
Yeah. Well, another thing I just went to, I thought of, do you remember the story about Dr. Dunbar and his wife?
I don't want to repeat anything like that.
That Dr. von Aldenburg told us?
Yeah, well, I don't want to repeat anything like that.
Yeah. Okay. Let me see.
Okay, I'm tired, Otto.
Yeah. I just want, did Dr. Ketchum, did he treat you well?
Yes, he did. He didn't change any of the medication,
Yeah.
but he said not to increase it or anything.
Yeah. Did he tell you anything about, when you mentioned to him about what had happened, what he told you? Do you remember what he told you?
No.
I can't think of anything when I could ask you that you don't remember.
Well, I'm trying.
Yeah, I know you're trying,
It's very tiring to
Yeah.
remember 7 years ago, Otto.
Yeah, I know. What did,
I remember they wouldn't let me smoke. I had to go to the counter and they would give me 1 cigarette.
yeah,
And I could have 1 cigarette an hour.
yeah,
And that was it.
yeah. As far as, I was wondering if you can remember at all when he prescribed to you writing out the prescriptions, take 2 a day. On the prescriptions, it was 2 a day. It was something about he was saving you money, or you didn't have to take that many.
Who was that?
Dr. Hughes?
No. You're getting me confused now,
Sorry.
because you're going from one to the
Yeah,
other
I'm just
one.
trying to see if you can remember some of these things. I think you're having a hard time remembering a lot of them.
Well, let's,
Okay, you're on now.
yes,
There's a few
I-
things that you remember.
few things I remember last night, and I thought I would mention it today. Um, One thing, one day, I opened my eyes, I was asleep, I opened my eyes, and he had his face right on to my face and was looking in my eyes.
Who was that now?
Dr. Hughes. And then my son came in and asked him what he was doing, and he said he wasn't doing anything. Then I remember the rage that he went in when we asked for a second opinion. He stormed out of the room and said that he wasn't gonna have anything like that, that his word was good and he didn't accept second opinion. And we had to get another doctor.
This occurred in your second hospitalization,
Yes.
and you were in the hospital room at that time.
Yes.
When he was he grasping you at all? Can you remember anything about if he was grasping you when he was staring in your eyes? Okay. Another thing too was when he stormed out of the room, did you get very upset over this?
Yes.
And was this at that time? Was there any procedure that he was, or paperwork that he wanted to have you sign?
No.
Oh, you can't remember that. Let me see.
No, not that I can remember.
Yeah. Okay.
Then I remember they would give me medication, and then I would have terrible nightmare, and I would hear dogs, and they were in pack, and Dr. Hughes was the head of the pack. That I remember.
Okay.
And then I remember giving my rings to the nurse, my wedding band and my engagement ring, so she would protect me against what was going on. And there was hollering and yelling. Then she brought me into my bedroom, and she said not to worry, that everything was all right.
Can you remember that nurse's name or her description of her?
No, I can't.
Okay.
Then I remember Dr. Robleski, when I would go to the desk to get the cigarette, he was very rude. He didn't believe in anybody smoking, but I could have one cigarette an hour. And he'd make me wait there. He'd make me wait 10, 15 minutes for a cigarette. Then I would go and sit into the room where they had the TV, and lots of people in the room, and they would look at me strange, and they were all strange people.
Yeah.
And sometime they would talk to me and look at me strangely. And then there were people that were in the rooms, and they would come in like for 2 days, and they would go, and they would come back for 2 days again. And then the nurse would check on me. And after Dr. von Albenberg took over, he was a lot more understanding, and he wanted to get me out of there. Where before that I had no hope I would get out of there.
Did Dr. Fontana say anything about Dr. Hughes that you can remember?
No.
Okay. Why don't I let Dad talk and see what sort of information he can provide, okay? You can stay there.
No, that's all. Well, I don't have much.
Well,
Otto,
we'll see what you... Alright.
okay, my name is Harry Snow, and I'm the husband of Marie Paul Snow, who you have been listening to here. Now, we were both going to the same doctor to begin with. However, I found that, in my own estimation, I'm talking psychiatrists, not all psychiatrists, but many of them, I believe, are over-prescribing medications that are not helping the patient, but are placing them in a situation that is, excuse me, that instead of combating what they have, is more than building up their ailment, if you want to put it in those words. And I think the medical profession should go deeper into this subject of psychiatry.
He was an MD too.
And the point of this is that some, I feel, are not prescribing what is better for the patient. Now, in that one part that my wife had mentioned about the doctor storming out of the room, we found that we had merely asked for a second opinion. And I cannot see how any doctor in any of those professions could ever be opposed to having a second opinion. That would be part of their education. They should not ignore it. It's not hurting them. It's helping them.
When he was stormed out of the room, was this concerning about allowing them to give her electroshocks?
That is correct. That's one thing I want to bring up. I am opposed to electroshock treatment. That, to me, reminds me of trying to electrocute the patient and not help them with electroshock. I would ban it.
He got mad because you wouldn't sign for having...
And the reason why he stormed out was we had stopped the continued
this was previous to the electroshocks.
No, this was after, as I recall.
Yeah.
To stop Dr. Hughes from giving the electroshock, my son and my husband had to go and see a lawyer and notify Dr. Dunn, Dr. Hughes, and the hospital, St. Joseph Hospital, so that they would stop. Otherwise, they wanted to keep on going.
You didn't want these shocks, did you?
I didn't know what they were.
Yeah. No one had explained to you?
No.
No one explained. Okay. Why don't I ask Dad some more questions, okay?
Excuse me.
You had gone to him for many years, and did you notice any strange things as far as going to see him or receiving medications from him or the effects of these medications?
Actually, no. I considered that he was a doctor and was prescribing what was necessary for my particular case.
You had mentioned to me before something about the Ellaville causing you to have shakes.
Yes. And not only that, I had spoken to other people who had Ellavilles, and they also had the shakes, trying to write or do something while you'd be all over the lot shaking.
Another thing I wanted to ask you was, you had an operation on, he did an operation on your face for...
Yeah, that was for skin cancer.
And where was this done?
That was done in
Outpatient.
Nashua, outpatient.
And did he mention anything as far as him being qualified to do this beforehand, or you should get another opinion of someone who was a surgeon?
No, there was nothing brought up about that. He merely stated that he could do it.
And could you discuss what had happened last year as far as this cancer that had been supposedly removed from your face?
Well, apparently all of the cancer had not been removed. And it progressed to a point that the surgery being done was more, well, I won't say exactly serious, but would be
Extensive?
yeah, more extensive and covered more of an area.
Another thing I want to discuss was or ask you, when you were a patient of Dr. Hughes, did you had discussed about him not wanting, or you had some sort of throat problems back then when you were visiting him as a patient? As
I can't recall to that fact.
I noticed something in the paperwork as far as you having supposed laryngitis.
Well, I don't know what that would be other than just that I had a sore throat or a condition like that.
After he had, he went into this rage in the hospital because I guess he wanted this paper signed for electroshocks on Mom. What did he do when you had asked him about your throat?
Well, he merely placed it that he didn't want it to have anything more to do with us, and that we should get another doctor.
Okay. And years later, or the following year, you had to undergo surgery on your throat.
No, that was a couple of months later.
A couple months later, you had to undergo surgery on your throat.
Well, actually, it was, you removed looking down my throat, they removed a small tumor that was on my vocal cord.
It was malignant.
That turned out to be malignant.
And this was removed by a surgeon. This was removed by a surgeon.
Yes.
A few years ago, you had to undergo surgery again,
Yes.
and
He had,
could you describe some of this?
Well, merely surgery on my vocal cords to remove a cancer. And that had apparently it grown. And so that is why my voice now is not that good.
Okay.
Because they had to remove some of the vocal cords.
after they took the tumor, they gave him
Radiation. Oh, well. Yeah, after the first surgery, you had to go through radiation.
Yes. They thought that in the event that they did not get, say, all of the cancer that would be around that area, that the radiation would be helpful to kill any other cancer that would be there.
Yeah.
But they had missed.
Okay.
That also proved to be effective for a good 6 months.
Yeah.
Then the cancer came back.
Okay. When Ma was going to see Dr. von Aldenberg, and you were living in the apartment, what was her mental state at that point?
Well, she had improved a great deal from being in the hospital. So it seemed as though she was getting back to a little more normal. However, after getting in the hospital and after the electroshock, I noticed that there were many things that she could not recall that she had done all of her life, but could not remember how to do, such as sewing.
Okay, I'll let Ma.
I used to make all my clothes, and I used to sew, and now I can't even sew a button on a shirt. I try. I cannot run the sewing machine, so I think something erased part of my memory.
Also, I was wondering, after you had came out of the hospital and were being treated by Dr. von Aldenberg, did you give us a little information on your concentration and your fears and things like that?
I really can't remember.
Yeah.
I mean,
your memory only started to improve after going to Dr. Fleischman and changing these medications?
Yes.
Um,
Dr. Fleischman was the one that helped me.
you know, he cut the pills off that you were being given.
Yes.
Okay. Can you sew today?
No.
Can you drive today?
No.
Do you feel afraid of these individuals, Dr. Hughes, and you wouldn't want to go back to them to have them treat you, would you?
No, but I'm not afraid of him.
Yeah. Do you feel that he's a powerful man?
Yes.
Do you think he's an evil man?
In some way. Because he talks about other patient, the patient that leave, he talks about him once he left.
With other patients?
Yes.
He had mentioned, I probably asked you earlier, when I began going over to Attorney Cherbuck's office, and he was showing me how to run business programs and how to run the various computers. Can you recall any of what he had said as far as me being friends with this attorney?
Well, he said he was an alcoholic, and he was doing all kinds of crazy things when he had the drinks, and he didn't think he was a good influence on anybody.
Yeah, he didn't want me to associate with him.
No.
Did he make any inferences as far as his strange behavior, what he would do?
No.
You know, you don't have to be afraid as far as this thing with the children or the little boys.
That I can't remember. All what I can remember is he said he put bonnet. That's all what I can remember.
Okay, fine. Well, we'll cut this off right here unless you have anything more you want to.
That's it. That's fine.
Yeah.
Everything's been covered.
There was one thing that I wanted to ask you. When Dr. Hughes wanted signature for this electroshocks or ECT, did you receive any explanation?
No, there's nothing was of any significance was said other than we thought, well, maybe that would be helpful. But as far as anything further, it was not brought up. It wasn't until later on, after we had stopped it, that the electric shock, in many cases, will erase parts of the memory. And this is what I have seen with my wife when she was so capable of various things. Now those parts of her memory have been erased, and she cannot bring them back.
Do you feel it has harmed her in years to come?
Well, it has up to the present time in the fact that she can't remember the things that she could do before.
Well, these things were dear to her.
That is correct.
Did any of the nurses explain the dangers or hazards with
No, nothing was brought up to that effect.
when? So you told him directly that you did not want electroshocks done on Mom.
Well, that's when you and I spoke to the lawyer, and he wrote the note so that the electroshock treatment
in that room, when he went into that rage, you had told him that you didn't want the electroshocks.
That's right. That was after he received the letter from the lawyer.
That he stopped.
And the discontinuing of electric shock treatment.
Yeah. Okay, I think that about sums it up. I'll give my information now. I'll pause here. Hello, my name is Otto Snow. I'm Harry and Marie's son, and I also went to Dr. Hughes as a patient, and I will try to do a summary of this and explain a little more in detail what had happened and what went on over the period of years. In 1973, I began to see Dr. Hughes. I was suffering from allergies, and I had them ever since childhood. I've had migraine headaches. I was hospitalized before for migraine headaches, and I began seeing him to give me the allergy injections. An allergist that I had would mail the serum to him, and I would get these injections. Before coming to see him, I had been having these injections for many years, no problems whatsoever. When I started to go see Dr. Hughes, he was continuing to give these injections, and I was receiving injections. The solution was a 1/10 dilution solution of these allergens. I was receiving the injection, and the allergist had sent a bottle of full-strength solution. I began getting severe reactions from these injections. My arm, they were given intramuscular, and the allergist had always told me that I should be given these subcutaneously. I always said to the nurses, don't inject it into the muscle, just slide it under my skin. The adverse effects of these injections were my arm would swell up double its size. It would be as though I had been punched several times on my arm. It would itch, and I would become very hyperactive. Problems breathing, and I was prescribed, Dr. Hughes prescribed to me PBZ, ephedrine, epinephrine or something, and also meprobamate. And repeatedly I said I did not want to get these shots anymore, to my parents, to him, and I didn't want to take these medications either. When I would take the meprobamate, he was prescribing it 400 milligrams 3 times a day, and I felt like I was drunk. They were really potent on me. He gave me handfuls of free samples, little bottles, little plastic free sample bottles. I discontinued taking the allergy injections because of the severe reactions that I was getting off them, and figured that the allergies were, it was better to have the allergies than the injections. The injections were worse than the allergies, so I discontinued those. Throughout the years that I was his patient, I was prescribed quantities of free samples, transines. I was prazepam, Dalmanes, Valiums, Libriums, all sorts of these medications in large size boxes, and I noticed that there was problems with my parents receiving these medications, the medications that they were getting. Would you let me finish this thing? I'll say right now that both my parents are very hesitant about giving even the slight bit of information. For years, it was a horror that I could not get away from him, get them away from him. Family life was almost impossible to deal with. Ma, I've got to work on this. Go sit down. She gets upset when I discuss this. Anyways, I continued to go and see him. I started in 1973 and received all of these medications. I would mention to him that there was problems with the folks. I didn't think that he should be prescribing these Elavils. I noticed them shaking. My mother having severe constipation, sleep disorders for many years, and I'm going to put on pause for a bit and take a break. Back again. Over the period of years, I could notice that in my parents that they were having muscle twitches, tremors, sleep problems. My mother was having severe mood swings. I attempted to stop them from going to see him, which proved useless. I would go also to the physician and say, I think it is the medications that you've been prescribing. He prescribed Librium and Periactin to my mother for 3 years straight. And she had problems with her stomach, and had problems with her throat, repeated respiratory infections and whatever, bronchitis. And Dr. Hughes sent her to have x-rays done of her chest, and I have many of the records here, and I would like to refer back to these, so I think they give a clearer picture of what had happened, what was going on. Okay, in 1976 at St. Joseph's Hospital, the x-ray report said that she had a normal gallbladder. And in the chest, it said the heart is normal in size and shape. The lungs are hyperexpanded. The lungs are free of active infiltrate. No bony abnormalities. No soft tissue abnormalities. Opinion, pulmonary emphysema. The thyroid is normal. And I would like to go through in I can't make out exactly the date here. I would have to go through other files to see if I could get a clearer copy. Looks like 1970, chest, impression, pulmonary emphysema. My mother at that time was age 49, so I think that was, however you can work out the dates on that. It was sometime in the date must have been 1974 approximately. Later on, at that time, he switched her medications to Elavil, and from the beginning of her going to see him, she was prescribed Dalmane 30 milligrams for 10 years straight at bedtime. She complained continuously of sleep problems, even with the taking the Dalmane. She always complained she had never had a good night's sleep. The free samples of Dalmane, those large hospital boxes of free samples were given to her by Dr. Hughes, and they came in a laminated strip that would come out with the Dalmanes on them. On the side it said something for institutional use only, not for resale. I contacted the FDA to find out more about benzodiazepine type sedative hypnotics such as Dalmane, which its generic name is flurazepam. And they were very good at providing a trickle of information for me. And I would like to read a part of a paper. It's called On Making It Through the Night, and it's by Judith Willis. And it's a publication, it's a reprint from the FDA Consumer. I'll read some of this. Sleeplessness was in the news when the news was no more than gossip. Today is no different, except nowadays drugs are often used to induce sleep. This article examines the safety of some of those drugs as well as coping with the problem without chemicals. A study on sedative hypnotic drugs issued by the National Academy of Sciences Institute of Medicine conducted the study at a request from the White House, Office of Drug Policy, and the National Institute on Drug Abuse. Of significance to insomniacs seeking prescription drugs was the Institute of Medicine's reports advice to physicians to restrict the use of sedative hypnotic drugs to short-term treatment of insomnia. The Institute found little evidence that sedative hypnotics in general continue to be effective when used nightly over long periods. Indeed, sleep laboratory research on sleeping pills shows that practically all lose their sleep-promoting effectiveness after 3 to 14 days of continuous use. Of the sedative hypnotic benzodiazepines, most widely prescribed was Dalmane. I guess now there's Halcyon, which is the latest version. Most notably, Dalmane. However, there is now evidence that benzodiazepines suppress sleep stages 3 and 4. Let's go through this little bit here. I'll read from the physician's desk reference, which I have found to be grossly inadequate. The Extra Pharmacopoeia by Martindale is a little bit more comprehensive. In order to get a full understanding of how these medications work is by looking into other journal articles and medical books. Anyways, in the PDR it says Dalmane has been determined to be effective for at least 28 consecutive nights. Since insomnia is transient and intermittent, the prolonged use of hypnotics is not indicated. No, I'm not through. Let me go through with this thing.
You said it was for me,
And for me, let me continue with this.
because you can't send me to everybody.
Okay.
I don't know why you want all
I was reading in the book Principles of Neurology by Adams. This was in St. Joseph's Library. The edition I'm reading from is copyright 1981. Flurazepam, which is the generic name for Dalmane, reduces stage 4 sleep. And this is a comment that they put in here. The chronic insomniac who has no other symptoms should not be permitted to use sedative drugs as a crutch on which to limp through life. The solution of this problem is rarely to be found in medication. One should search out and correct, if possible, any underlying situational or psychological difficulty using medication only as a temporary measure. My mother had various problems with her eyes at an early stage in the treatment by Dr. Hughes.
I did not.
And
I did not.
okay. And first I will read a paper. In July of 1980, she went to the Retina Associates in Boston, Massachusetts. And the summary of the report is, I'm happy to tell you that there is no abnormal leakage present in either retina. At this time, there is good news. You should continue to see your optometrist for regular examinations, but there is no need for you to be treated with laser or any other method at this time. You should use your eyes normally. I've got paperwork everywhere. from the main eye care associates, this was after her being going through what had happened in St. Joseph's Hospital. Pictures were taken in a laser lab, as you know, last week. The retina is perfectly intact. They are both retinas. Show impairment of your circulation, so that the retina in the very center of your sight, which is the part which you need to read, does not function as well as it used to. This, in conjunction with very early cataracts, has contributed to a gradual reduction of your vision. It is perfectly all right to go ahead and use your eyes as you want to. This will not hasten any degeneration. However, the cataracts get worse, as you know, and sometimes this retinal condition slowly gets a little worse. It is for these two reasons that I would like to see you in about 1 year in my office. And see that she was complaining of eye problems years previous to her hospitalization. Changes were taking place at that time. I have found information that phenothiazines or any of these anticholinergic type medications Would you let me continue with this?
You told us it was for your father and us, and you didn't tell Jim that.
Yes, I said that I would give a statement. I can't have you pacing back and forth behind the camera. Go sit in the kitchen, Mom. While my mother was being treated by Dr. Hughes, I was seeing, oh, Dad, this has got to stop. I've got to finish with this thing. My mother had came home and she had said, Dr. Hughes had mentioned that Attorney Cherbuck was suffering from some sort of mental disorder and was dressing little boys in girls' clothes and chasing them about, and that I should not associate with this man. I went through the paperwork, his paperwork, and it says that I am going out with so-and-so attorney with big exclamation points after it. Another time I had told my mother not to take the medications any longer and to get another physician. It was driving me up the wall seeing what they were doing to my parents, the sleep disorders, the repeated bronchial infections, the hospitalization for my father twice under Dr. Hughes' care. He wrote in her records that I was schizophrenic and that I should start taking Elavil 3 times a day at a 25 milligram dosage. Any Elavils that I was being given as free samples through my mother from Dr. Hughes, I flushed them. I didn't want to take any of these medications. I have found out that it's contraindicated to prescribe tricyclic antidepressants such as Elavil or imipramine to schizophrenics because it exacerbates the disease. And I'll go into the hospitalization of my mother at this point. This is check here to see if it's picking up. No, I don't need that.
Okay, I just want to be sure.
Yeah, okay, thanks.
Okay, and you try to do it.
Well, back again on the spot where, okay, might be able to, yeah. Oh, boy. I'm going to discuss about what happened previous to her hospitalization, immediately before the hospitalization. I had moved up north. I was living with my parents. I had moved up north. At home it was very stressful. The house looked more like a pharmacy than a home. The kitchen table was covered with, I'd say, right in the middle of the table, there must have been about 50 bottles of all sorts of prescriptions and various medications, free samples. There was a drawer next to the telephone that was completely full of free samples. In the bathroom, the towel, the closet for the towels was completely full. There was many shelves that were completely full of free samples, psychoactive drugs, anything new that was given to Dr. Hughes by detail men from the pharmaceutical houses was given to the folks. And okay. I'm going to have to pause this again until she gets a piece of toast. So, free to talk. Well, I'll try to do the tape here. And maybe I won't be disturbed here. It's probably going to be an echo in this thing because I'm in a small room. Previous to my mother's hospitalization, I had moved up north, and she went to see Dr. Hughes while I was up north, and I received a phone call that she needed my help, and her and my father was sick. So I asked her why she was sick, what was sick, and she says that she couldn't remember. I came home, and she was walking around the house with her hands to her mouth like this, and rigid mechanical movements. And I said, "Have you been taking any medications?" She said that she had gone to see Dr. Hughes and that she had bronchitis, or what he commonly referred to, what he called dry pleurisy. Anytime she was sick, it was dry pleurisy. I looked at the medications, and she was being prescribed tetracycline, a cough medicine called Phenergan VC, along with her usual Dalmane 30, Valiums, and Elavil. At this time, I speculated that it was an adverse drug reaction, and I phoned Dr. Hughes, and I said to him that I will be taking her to the hospital because I can see that she is not well at all. She couldn't remember anything. Couldn't remember she ate. My father had been drinking. He didn't want me to bring her anywhere. Over the period of years to this point, she had become a virtual shut-in. Other than going for groceries, couldn't get her out of the house. My father didn't mind that. He just soon stay in the house. I had told Dr. Hughes in the past that my father drank, and I don't think it was good to prescribe tranquilizers to someone who drinks alcohol, and he said that the transines my father was being prescribed were very mild, and that not to worry about it. I brought a friend of mine helped me, and we brought my mother into the hospital, St. Joseph's Hospital in Nashua, and immediately she was diagnosed as having depression. Well, what I've found since then is that these medications are not shouldn't be mixed. Okay, what I'm going to read is about the Phenergan BC. One of the active ingredients in Phenergan is called promethazine. It is a phenothiazine derivative which differs structurally from the antipsychotic phenothiazines by the presence of a branched side chain and no ring substitution. It is thought this configuration is responsible for its relative lack, and in parentheses, 1/10 that of the trade name Thorazine, of dopaminergic central nervous system action. And here it says that promethazine may increase, cause problems. In three parts, in three sections of this, it mentions this sedative action of promethazine is additive to the sedative effects of other central nervous system depressants, including sedative hypnotics, tricyclic antidepressants, and tranquilizers. Therefore, these agents should be avoided or administered in reduced dosage to patients receiving promethazine. There was no reduction in her medicated, the dosage of any of these, of the Valium or the Elavil or the Dalmane. She was confused. She had problems walking. Couldn't remember. And I brought her into the hospital. She was diagnosed as being grossly depressed, and a nurse by the name of Margaret Gall, I think her name was. She had braces and glasses, dark hair. I remember she had the braces and the dark hair. My mother was brought into a room on the 5th floor, and Margaret came in with a hypodermic needle, and I asked her what was that she was going to be giving my mother, and she told me that it was a tranquilizer, something to calm her down. And I says, I think that my mother's having an adverse reaction to the medications. And I was told that we leave the diagnosis to the physician. So I asked her again, what was she giving my mother? And she avoided the question, so I repeated it a third time. At this time she told me it was thoradiozyme. Not Thorazine, not Haldol, not Stelazine, but thoradiozyme. She administered the injection to my mother, and within, say, 10 or 15 minutes, she began hallucinating. Dogs coming out of the TV, attacking her. It was, by this point, she had taken on a fetal position. I went and I got the nurse, and one of the nurses, and she came in and she said to me, "Oh, there's nothing wrong here. We have to wait until the drug effect takes full hold." And she was panicking. My mother was panicking, hallucinating, and I told her that I wanted Hughes there, then, right now, and I wanted her out of the room that she's in. She was in a room with a woman who had a brain tumor and was dying, and she was cursing at my mother in French. I had pulled the divider in between the bed, and this woman had pulled the divider back and cursed more at my mother. I had lowered the TV. The woman increased the volume on the TV. I'm saying to myself, well, what the hell is going on in this hospital? Finally, Margaret came back in, and she said that she had contacted Dr. Hughes, or she was going to contact Dr. Hughes, and that my mother was fine. I could see that there was no way she was fine. I talked to another nurse. I said, I want her out of the room. I want her in a private room. She's having some sort of psychosis here, and that it wasn't beneficial for her to be with this other patient who was cursing at her, frightening her also. The TV, there was something with dogs on the TV, and my mother was hallucinating. Dogs were jumping out of the television set. This nurse, this short nurse, says to me, well, let me speak with you outside. And she says, the woman the other patient in the same room with your mother has a brain tumor. And she's a very nice person. And once your mother gets to know her, they'll probably be best of friends. I said, my mother's having some sort of psychosis, and she's not going to be best of friends with anyone. She's terrified. Get her out of that room now. She came back within 5 minutes and pushed the bed down the hallway into another room. By this point, my mother was catatonic. She's in a rigid fetal position. Her eyes stared at the light or the window. There was no response. She kept mumbling about dogs attacking her. We couldn't get her to eat. They kept prescribing her medications. here for medications. If I have paperwork with me here. Move around so much trying to get this out. Meloril, Loxetane, Elavil, Norpremin, Sinequan, Vivactyl, Dalmane, Librium, Valium. This went on for over a week. She remained in the state. Dr. Hughes came in and spoke with my aunt, who has arrived from Canada. My father was hospitalized also because I couldn't stop him from, I couldn't snap to, kept wanting more beer. I said to him, things have got to be straightened out. He was down the hall from my mother, being given intravenous liquids and sedatives. Dr. Hughes spoke with my aunt and myself, and he says, what your mother has is a serious mental illness. And he was very concerned. Bums a cigarette off me. And my aunt asked, well, I'd like to know a little bit more about this. And he says, she asked what was causing this mental illness. And he says, we in the medical community don't know the causes of mental illness. And, he said it's of hereditary nature. So my aunt says to him that she had traced the family tree back 10 generations and found no indication of mental illness in the family. He was grasping for words, and he says that probably the sale of the house and my father's retirement were factors in this. And my aunt says that's strange because my father wasn't retiring for another year, and that they hadn't sold their house. So I mentioned to my aunt that they had signed some papers to with a real estate agent to sell the house for them, but they had not gone to the closing. And at that point, Hughes says, do not give up hope, because mental illnesses are strange, or have a way of going into remission. The following day, the drugs were cut. She wasn't receiving any drugs except for a vitamin called the Baroka. By the end of the day, she was starting to make eye contact. She began taking food, drinking more liquids, more water. Her mumbling about bugs and dogs and things had stopped. And she says she mentioned that she was very constipated and she wanted an enema. The nurses gave her an enema. We helped her to the bathroom 3 or 4 times. A few hours after that, she snapped right out of it. She turns around and says to me, Otto, you need a haircut. And the joy we felt at that time was incredible. And knew she was back. My father came in and he was joyed to see that she was back to her usual self. And over the following days she was given Baroka. She wasn't given any medications. My aunt and I sat there from early morning until 11 or 12 at night every night throughout this whole thing. And Dr. Hughes came in. We hadn't seen him for a few days. He came in and he says, dearie, you always his English accent, and glad to see that you've recovered. And she was sent home with a prescription for 3 times the amount of Elavil that she had been prescribed previously. The total was 75 milligrams at bedtime. Before being admitted to the hospital, she had been complaining to me of dryness in her mouth, constipation, all adverse effects of tricyclic medications. She was in the cellar spraying non-existent ants. There was a few ants, dead ants in the cellar with the spring rains and early summer rains. The ants do come in the bulkhead door into the cellar, and there's a crack along the floor. I had swept any ants that were in there, dead ants. She was spraying Raid ant and roach killer. I had told her that I thought at the time it was the Elavil because I've read in the PDR that it can cause hallucinations. And she wasn't eating properly, no socialization. I couldn't. Anyway, she was sent home from, the doctor, before she went into the hospital, he was prescribing her 2 tablets daily of Elavil on the prescription. Every time that she would come home, she would tell me that he told her only to take 1 of these Elavils. And this was for quite some time, a year or more before being hospitalized, only to take 1 Elavil a day. And that he wrote these prescriptions to save her money because they were cheaper in quantity. There was a house full of these drugs. She came home. I didn't want her to take the Elavil. I said, let's flush them damn things. When she went into the pharmacy to pick these up, what she and my aunt had told me was, this was Town and Country Pharmacy. She was told by the pharmacist, he had asked her, have you been sick lately? I haven't seen you in here, or something or other. And she said I was in the hospital, and the pharmacist said, I thought you would get sick taking all those medications. My aunt and my mother told me about this. They're out in the hallway now. Well, I'm back again. Over the period of days after being released from the hospital, my father was also released from the hospital. I've got to move along with this thing. I've got to bring the camera back to the rental shop.
was released with a prescription to 75 milligrams of Librium. He was totally subdued. I had spoken with my father, and we agreed that she should not get any more Elavils. They had seen the serious problems that were happening with this medication, the muscles jumping, twitching, dryness. So, when she came back with the prescription and said this, I said, maybe you shouldn't take this medication, don't take this medication. My aunt, my father fought with me that she should receive this medication again. She took the 75 milligrams of Elavil at bedtime, began hearing people in our cellar talking about ants eating the house, getting more and more frantic. She stopped sleeping. She wouldn't eat. I told my aunt that it's getting serious. She was totally confused. Her eyes were distant. Same things that had occurred before her hospitalization were occurring again. I could see a repeat of this. I could not do anything to stop her from taking these medications. My aunt brought my mother to the to Dr. Hughes. At this time, Dr. Hughes prescribed her stelazine and carbitol, a barbiturate, to take. Stelazine is a neuroleptic, another one of these antipsychotic drugs like Mellaril. I went to the pharmacy. My mother, on the way back from the physician's office, my mother tried jumping out of my aunt's car. I couldn't go because my mother kept saying that she would wind up in an asylum if I went with her to see Dr. Hughes, and he was going to get me. She tried jumping out of the car while she was traveling down the road. My aunt had to grab her by the arm and hold her from leaping onto the pavement and pull the car over. My aunt has a heart condition. It was very, very hard on my aunt. When she came home, my mother was totally frantic, running around the house, wondering, where's my sister, where's my sister? My aunt had to go and get something at the store or get away from it for a bit. It's too much on her. I went to get these prescriptions filled, and when I did, I asked the pharmacist, I said, you had mentioned to my mother that you figured that something would happen with her taking these medications that she had been previously prescribed. And he says, yes, I did. And when I further questioned him on it, he just said that he fills the prescriptions and to speak with the doctor. I asked him at that time, what is stelazine? I had heard that it was some sort of neuroleptic. I didn't know. I knew something about these medications, but I wasn't as informed as I am today. The severity of these potentially dangerous drugs. He said stelazine was a neuroleptic antipsychotic medication similar to Mellaril. Carbitol was a barbiturate type of sedative. I said drugs, more these damn drugs. I came home. My mother was she was having rigid movements again, like I had seen her previous to the hospitalization. Hands to her mouth. I could could see intense fear in her eyes. I held her. It didn't seem to comfort her. She just paced back and forth. My aunt's sitting in the living room. My father's sitting in the living room reading a book. I says, I'm very frightened that something is going to happen with my mother. She doesn't look good, and I'm very frightened. She had been talking about suicide at this time. She says, I can't be a burden. They're after me. She was saying they were after her. She had gone through all her the paid insurance sheets and had thrown them in the trash, which I retrieved. She began ripping the massive amount of prescriptions that had not been filled over the period of months, including the repeated prescriptions that Hughes was given my mother for me to take: Elavil, Balmain, Valiums. It was totally frantic. I told my aunt and my father I was very afraid she was getting worse, and it was, well, maybe these medications will help her. She didn't even take these medications. She had taken a kitchen carving knife and put it under her pillow, I guess, or something in her bedroom. And I said to my aunt, I think you'd better check on my mother. We've got to keep an eye on her. She went into my mother's room and found her standing up. Both her wrists had been slashed with the kitchen carving knife. There's blood everywhere. She screamed for me. I came in, took my mother into the living room. I had to pin her down because she was pulling back the flesh on the lacerations in her wrists, saying she wanted to die. My aunt called an ambulance. We put wet, damp cloths on her lacerations and my father and I held her arms apart. My father had to straddle across her. The ambulance arrived, the police came. I knew one of the officers. He was a school buddy of mine. He took off his hat, came into the house, spoke very softly to my mother, saying that the Lord wants her to live and we want her to live. And she was strapped into the stretcher and brought to St. Joe's Hospital. On the way over, she had mentioned to my father that she didn't want the siren going because it would disturb her. This was a very clear, she was very clear about this. It wasn't the same state that she was in. She had lost quite a bit of blood. In the hospital, they stitched her lacerations. She cut one of her tendons. The surgeon said that she'd be okay. My mother was reasonably clear at this point. We were discussing with her that she shouldn't take these medications. She agreed. She wouldn't take Elavil again. At this point, I'd like to go into a little bit about the pharmacology of these things and the adverse effects that I'd seen in the past. She had been given Mellaril many years prior. She developed a rash and was shaking, and this was at a 15 milligram dosage that Hughes had prescribed her, and it's in his notes. She had also been given Ativan. I think it was at a 25 milligram dose, also known as Doxepin is the generic name. No, not Ativan. And the generic name is Doxepin. A 25 milligram dosage, and she had twitches in her muscles. We could actually see her muscles twitching, and when she went into the hospital after being stitched up, Nurse Margaret again injected her with thordiazine. I says, maybe you should contact Dr. Hughes. She said that's what the doctor had ordered, and she was doing as what the doctor ordered. My mother started hallucinating again, went into a catatonic state. This lasted, where she would mumble about dogs and hallucinations. They pumped her with drugs. This went on. I kept saying, stop the drugs, to use. He wouldn't show up. I couldn't get access to her medical paperwork to see what drugs she had been given. I had to dig into the trash to take the little packets from the laminated strips, because these hospital packets, they, after they give her the drug, a pill or a pill or a capsule, they would throw them in the trash. The nurses were, Margaret primarily was very belligerent when it would come to asking her what she was being given for drugs. And patients were dying on this floor. They were being wheeled down the corridor. My aunt was becoming more afraid. The stress was too much. She went back to Canada, and I'm glad she did, because I think it would have inevitably killed my aunt watching what was going on. She couldn't believe what was happening. Dr. Hughes, I had walked down the hallway. I came into I could hear someone yelling. I walked into my mother's room. Dr. Hughes had his hands above her sutures and was grasping her tightly. His face was inches from her face. He was telling her to sign the paper. She was screaming at him, "You're the dog-faced man," by this point. I had been telling her to fight the drugs, to try to eat. She wasn't eating good. In the medical paperwork, it says that she's eating fine and normal and regular. She didn't eat until a few days before her release the first time in the hospital. The second time was the same way. She didn't have regular bowel movements. She didn't have any bowel movements except for when she was given this enema. I said, when I walked into her room and saw Dr. Hughes like that, she screamed at him, "You're the dog-faced man." And he let go of her, and there was marks on her arms where he had been holding her, grasping her tightly. And I asked him, "What's going on here?" And he says, "Oh, I'm only trying to get your mother well, and we've tried all these medications, and she needs to sign for electroshock therapy." And my mother's saying to me, "No, I don't want any shocks. I want to get out of here. They're going to kill us all." I said, "You're not going to get any shocks." My father came in. We're given no explanations. We all says we don't want any of these shocks. He says, "You have no choice. The medications haven't worked." I kept saying to him, "Cut the medications off. We want another opinion." At this time, my father said that he wanted another opinion. Hughes pointed at my mother and said, "No more drugs for you. I don't want anything to do with any of you people. I'm off the case. Find yourself another physician." And he stormed out the room. My mother became frantic. She said, "I'll sign anything." He went down the hallway. My father had been having laryngitis for many months. He had asked Dr. Hughes, he says, "Aren't you going to look at my throat?" I had figured at this point we were through with that guy. Maybe we'll get someone who will stop these drugs. I've seen 10 years of it. I'm seeing her being drugged out in the hospital. Hughes goes like this to my father. Waddles down the hallway. The following day, a couple days later, Margaret was coming. I noticed some nurses in my mother's room trying to get her to sign the paper. I said, don't force her to sign any paperwork. We don't want this. My father had to sign for her rings, and it says at the top, fill complete only if patient is incompetent. My father had to sign for these. The nurses kept coming in with paperwork for her to sign for electroshocks. One morning I went in, I was calling a psychiatrist. Now the psychiatrist would have anything to do with me. I went into Dr. Eisen's office. I called over and over. I finally went over. He was supposed to call me back, didn't call me back. I went in. There was a patient waiting there. I said my name. The receptionist went out back, came back and told me Dr. Eisen's on vacation. I said, who's this patient waiting to see? Dr. von Oldenburg said that he had too many patients, so he couldn't accept any new patients. All these doctors were on vacation. They had too many patients. I called the psychologist and he says he couldn't even handle it because there was too much politics involved. I went in one morning and Margaret was coming out of the room with the signed paper for consent for electroshocks. I went in, I told her she's not going to get any, we don't want any, we want a second opinion. And she says, well, Dr. Hughes, as long as he's in the physician, we don't have another one, that he's going to continue to do what he wants. I asked my mother, what did you sign? And she says, Margaret told me that it was an insurance form, and I want to make sure my bills are paid. And I contacted one attorney. The attorney says I could write to the Board of Medicine, and they could go over it. And she was given 2 electroshocks. On the first electroshock, I contacted Dr. Hughes. He was supposed to meet me in the lobby in the morning before the second electroshock. I wanted him discontinued completely. I had talked to nurses, supposedly head of the floor. They just kept saying, you're going to have to talk to your doctor. After the first, on the morning of the second shock, Dr. Hughes didn't show up in the lobby. I went upstairs. She had been given another electroshock. Margaret says, you'll have to come in. They're perfectly safe. You'll have to come in tomorrow and watch. And at that point, I knew that I had to get out of that hospital. I contacted Attorney Leonard, who had came back from vacation or something. I'd been trying to contact him for the time that he was on vacation. He signed, I got my father, we went down, we had him fill out a paper telling Dr. Dunn, Dr. Hughes, and St. Joe's that we wanted a second opinion to discontinue the shocks. Dr. von Oldenburg took the case. He gave her some Silert, and she started to snap out of this real state that she was in. He lowered the dosage of the Melorel, continued to prescribe her various psychoactives, which are anticholinergic, including Benadryl. My mother had this went on for a year. My mother couldn't concentrate long enough to comprehend a television commercial. She would have several cigarettes in the ashtrays going at the same time. My father was diagnosed with cancer. He had to go for surgery that Hughes had diagnosed as laryngitis. I had to drive him every day for radiation after the surgery in Manchester. Dr. von Oldenburg was talking about other physicians. He says Dr. Hughes will finally go out of business. Every time my mother would snap out about how he was a dope pusher and shouldn't be allowed to practice, he would say he'd try some free samples. Gave her Halcyon and Xanax. Caused glassy eyes, more confusion. I was doing the driving, cooking. shopping, help my mother, would take clothes downstairs and show her how to work the washing machine. Remember, was shot. At one time, Dr. von Oldenburg, my mother doesn't like to speak about it because it's kind of rude, he had said that Dr. Brokum, Dr. Brown, it was Dr. Dunbar got a divorce from his wife, and he had gone back to England. And before, it was a very bad divorce, and before the divorce, his wife, here they are disturbing me. What? Yeah, just a minute. He had said that Dr. Dunbar's wife would spread her legs for 30 seconds, and she had a little clock, and she would say, if you're not finished in 30 seconds, I'm closing my legs. And he laughed over this. I didn't find it amusing at all. I figured there was some sort of a dirty rumor. It sounded like something that would be spread by Dr. Hughes. One time while I was there, right in the beginning, his phone rang. He picks it up. He says, hello, hello, Dr. Dunn. No, it's not your fault for the electroshocks. Marie is fine. She's under my care. And it's Dr. Hughes' fault. I don't know what the hell that was about. But then he turns around and smiles and looks at us. She didn't make any recovery during that year. My father says she was better. Oh, of course she was better. She wasn't hallucinating, totally dark, just walking around, shuffling around, and still with these rigid movements, and couldn't concentrate, and all spaced out. We went to Maine. We went and saw Dr. Fleischman. I told him I want the anticholinergic drugs cut off, the Mellaril, the Benadryl. He did that. He replaced them with the anxiolytic Navaine. Within 2 weeks, she started coming out of this. Still very insecure. Her concentration increased, the rigidity stopped. The intense fear, it was continuous fear of, if it should hear sound, it was bugs or something. I tried to get the medical paperwork. My mother signed release forms. We were given incomplete records from St. Joe's Hospital. It would be like a signature on the bottom, and they were photocopied so light you couldn't make anything out. I'd repeatedly called the Drug Enforcement Administration. No help whatsoever. They told me that go find another doctor. When I had emptied their house, I'd taken 2 trash barrels of drugs out, and one trash bag completely full of drugs, controlled substances, free samples, and it was full of these things as evidence. And the DEA wasn't interested in the least. Finally, the Board of Medicine a woman wrote in and told them to give my mother her medical records, which cost her, I think it was $35. None of the physicians would, I have return receipts, and would send photocopies of her. Oh, jeez. Let me just keep on. In a little bit, okay? Whenever, just relax, okay? I have been unable to get anywhere with any of this. I have been taking care of them and fighting with these doctors to not to give her anticholinergic medications. At one point a physician wrote that she did have an anticholinergic delirium. Dr. Fleischman admitted nothing in his records except that I noticed that he was going to give her a medication which would cause an adverse effect with another medication. Didn't even want to call me back. I had to talk to the pharmacist, so the pharmacist could talk some sense to this guy. Nor in the records does it say anything about being coerced into electroshocks or anticholinergic delirium or this coma that is noted with neuroleptics. I've been, we've moved, this will be like the 10th move we'll be making in 7 years. She's always going to move. My dad just follows along with it. I've tried to get counseling for myself because of the severe stress of this thing. All I get is forget about it. Last psychiatrist she went and saw, he had prescribed her some, she's off the medications now, but he had prescribed her Benadryl to help her sleep because the FDA yanked tryptophan. I was arrested